Hey friends, welcome back. We're going to break down a new CDC report finding for the very first time that having a prior infection offers protection against new variants of COVID-19. Now, this is particularly important because we've heard data from Israel. We've shared that data with you. Going back to August 22nd or 21st when that study was first published, we broke that down. Here we are a full 6 months later, and our own public health institutions have repeatedly had speculative conversations around, well, we really don't know about the resiliency, the robustness, the protection offered by our own body's immune system. So therefore, even if you've had an infection before, you sort of don't, it doesn't matter. You don't count. You still need to you should get a booster. You should get vaccinated. You should do all these things. And now we have this new finding, this new outcome data with regards to protection against cases and hospitalizations for individuals who are unvaccinated yet have had a prior infection. Now, I think this is quite interesting because, and I think it's actually a little disappointing in terms of the timing because remember, the Delta variant was circulating throughout the world, not just in Israel, right? It wasn't isolated to Israel. Israel published data in over 600,000 subjects, and they started collecting data in February. They ended that data collection period, I think, on the 11th of August, and they published their findings around the 22nd of August. Here we are 6 months later, and we pride ourselves in America for being really sort of first to market. You know, we have some of the top researchers and scientists throughout the world and so forth. And we're just finally acknowledging after the CDC director, Rochelle Walensky, has admitted that she's getting media training because people are not trusting her communication style, her messaging. You know, trust in our institutions is at an all-time low. We get this report. It's like, well, friends, we've known this for probably now 50, 60 years that immunity matters. We have data from 2003 showing that individuals that were exposed to SARS-CoV-1, the first iteration of this now pandemic virus, still have T-cell immunity, right? We have data from Cleveland Clinic finding that individuals who had been exposed have a really statistically very low odds of having a symptomatic reinfection. And now the CDC finally comes out. I think it's better late than never, but how many healthcare workers had to get fired? How many first responders had to get fired? How many elective procedures had to be canceled because there was labor shortages, because of staffing crises, supply chain issues, joblessness? I mean, the whole thing. We have schools being closed because some teachers just they simply didn't want to get immunized or whatever. And so there's staffing shortages. How many of those kids are going to fall further behind, right? So that's why this is sort of frustrating, right? And you can sense the frustration in my voice. I'll share with you a quote actually from Marty Makary. What he says here, he's been kind of bullish and hawkish when it comes to the CDC policy and talking about how self-inflicted communication woes have actually caused the lack of the erosion of trust in this institution. Marty says the data are now abundantly clear. Natural immunity is more effective than vax immunity. This is his words, YouTube, not mine, just for the record. And he says, sadly, tens of thousands of Americans lost their jobs and livelihood because antibodies circulating in their blood are antibodies that the government did not recognize. Okay, antibodies are antibodies. T-cell immunity is T-cell immunity, no matter how you get it, right? So, it's this sort of groupthink has ruined careers, identity politics, and tribalism mentality has impacted a lot of people. Now, look, I know some of you that work from home and you're a computer engineer or whatever, you haven't been affected by this. But there are people who have had elective surgical procedures that have been canceled. There are people who have lost their jobs and their livelihood because they didn't see the medical necessity to get immunized against a disease that they've already had. And now we have our own institution recognizing that, hey, you know what? There is some protection here. So we're going to dive in to the study. But first, friends, I want to welcome you back. It's Mike Mutzel. If you're enjoying this content and you think your friends, your family member might enjoy it too, please share this video or this audio podcast with them. If you're listening in iTunes and Spotify, what you can do is check out the video version over here on YouTube for the images and the charts and everything that we talk about, because we're going to break down a few studies, not just this new CDC study, but historical studies that you understand why this is frustrating for myself and individuals who have been following these narratives. Also, friends, if you want to support our work and contribute to the cause of helping us to continue to break down these studies and so forth, support our sister company, Myoscience. We're coming out with a lot of apparel to help you inspire the people in your community to make healthier choices. What we've been trying to do, unfortunately and unsuccessfully, is control a respiratory virus through government interventions while we ignore health. What's as you can see, is probably not really working. We have high levels of obesity and metabolic disease. So we need to inspire people to eat healthier foods, to exercise more, to moderate their stress, and to balance their sleep. So we have this new shirt, Eat Like Your Life Depends on It. You can save by using the coupon code podcast at checkout. We have a bunch of shirts over there. I will link all those links in the descriptions and so forth. The website URL, if you're listening in iTunes or you're driving right now, is myoscience.com. That's MYOXCIENCE.com, myoscience.com. Check out some of the new t-shirts so that you can inspire people to take their lifestyle as seriously as they do double and triple masking. Okay, so here we go. Again, really interesting timing about this because we have this Israeli study that we talked about before. This was published on August 22nd, my friends. The title of that study is Comparing SARS-CoV-2 Natural Immunity to Vaccine-Induced Immunity, Reinfections versus Breakthrough Infections. So they were comparing people who are unexposed to the SARS-CoV-2 but had been vaccinated compared to people who already had an infection but are unvaxxed. And they looked at, during the Delta period. So they were tracking when Delta was circulating, and they found essentially equivalent protection, roughly, and maybe even a reduction in hospitalizations in people who had already been infected, right? But our own institutions repeatedly denied that. We heard over and over again from the pundits that you see on television, well, it's speculative, it's hopeful, that was a preprint, that hasn't been peer-reviewed, we're not really sure. I mean, we heard all of these different things. In fact, our own CDC published in their Morbidity Mortality Weekly Report that this is the exact sort of sub-journal within the CDC, MMWR. I check it out all the time. I like to read it. I want to know what's being published there. I think you should as well. On October 30th of this year, they published this particular paper. I'll share it with you on the screen here. And the New York Times reported, this is a New York Times article, saying vaccine offers more protection against COVID than prior infection, a CDC study suggests. Now, some of you might remember that study because there was a lot of tweets going around, and essentially they were saying that, and I'll quote here, the adjusted odds of laboratory-confirmed COVID-19 cases among unvaccinated adults with prior SARS-CoV-2 infection was 5.49-fold higher than the odds among fully vaccinated participants who had gotten one of the mRNA vaccines, okay? So that was 2 months after the Israeli Ministry of Health published their study. So that led to all this speculation about, well, maybe this natural immunity thing, it's natural, it's garbage, it doesn't work, it's ineffective. Yet we have a study here 3 months later that it's totally conflicting with that particular study. So it makes you scratch your head and go, well, I'm sorry, how can you come up with different data? And the indoctrinated people will say, well, yeah, because that particular study wasn't accounting for Delta. You're like, well, okay, this was published, that study that I just mentioned, that essentially what was new from that study, added by that report, was that a vaccine offers a 5.49-fold greater protection compared to prior infection. Okay, that was published on October 29th. Okay, Delta was circulating widely in the US starting in June, okay, through the fall. So why didn't they include that Delta period? They cut off the time frame of data collection of that study, I think it was January to September 1st. Okay, they didn't publish that report until 60 days later. Why didn't they continue to collect during the Delta period? I think that's a little interesting. Okay, so that's the background. That's the historical perspective. That's why there's frustration. That's why there's loss of trust within our own health institution. Okay, so let's break down this new report and find out what they actually said. So the title of the paper here, COVID-19 cases and hospitalization by COVID-19 vaccination status and previous COVID-19 diagnosis in California and New York between the months May and November of 2021. Now, the irony of the very first sentence in this entire report is this, and this is ironic because we've heard so much about Florida and the DeSantis variant, right? When Delta was circulating, that's what we heard. We heard so much about Texas, but you don't hear much about the high per capita death rates and the relatively high age-adjusted death rates in the state of New York, New Jersey, and California. Those are because they're the golden childs. They follow the science. Well, it's interesting. The very first sentence in this report by our own CDC says, by November 30th, 2021, approximately 130,000 COVID-19 associated deaths, that is 1 in 6 of all U.S. deaths from COVID-19, had occurred in the state of, guess what, California and New York. They're not throwing out Texas or Florida. This is from the CDC, my friends. So let me just pause because health has become very political. We know the media is essentially a political arm for the you-know-what political party, right? So they position Florida and Texas and other states who are not adhering to all these draconian, tyrannical measures as grandma-killing, unscientific following places where people are just dying in the streets. You know what's happening in Florida and Texas? People are living their lives. They are not thinking about the stuff that the media is talking about. They're going to the gym without a face mask. They're going to parties, and they're living happy, healthy lives. And so I think if you look, historians will review this. They're going to look at the states like Washington, Oregon, California, New York, New Jersey, Connecticut, and say, what were these people doing? Living in fear, when at the end of the day, the age-adjusted rates are going to be pretty much indistinguishable as they are now with regards to death, okay? So I think that's quite interesting. Now, let's continue on with this paper because I think it's just good to share with your friends and family. Look, I have heated debates with my own family members about natural immunity. They get mad at me. They say I'm a science denier. Here's the Wall Street Journal right here. I'm just going to quote this so YouTube knows that these are not my opinions. This is the Wall Street Journal. Surviving a previous infection provided better protection than vaccination against COVID-19 during the Delta wave, federal health authorities say, meaning the CDC says, citing research showing that both the shots and recovery from virus provided significant defense. So remember all that speculation about prior infection, all the naysayers saying we don't know about the resilience of an infection, so therefore you should just go out and get boosters for 12-year-olds. Well, we know actually an infection offers more, it's more redundant, right? You have the nucleocapsid, you have non-structural proteins, you have the spike protein, you have all of these structural elements as opposed to just one antigen, right? So I'm not suggesting that you don't get immunized. I'm not suggesting that high-risk people don't consider immunization. I'm not saying that. I'm just saying that I don't know why we have been doubting and speculating that natural immunity doesn't do anything when we know that there's more resilience here. So the Wall Street Journal says the Center for Disease Control and Prevention said Wednesday that data from 1.1 million COVID-19 cases in California and New York last year showed that people who were unvaccinated and haven't previously contracted COVID-19 faced a far greater risk than both people who had gotten the shots and people who had been previously infected. Okay, we know that. Okay, the data on testing cases and immunization was collected between May and November as the Delta variant emerged and became the dominant variant in the U.S. Before the more infectious Omicron, we know it's more infectious and transmissible, but we also know it's more mild, began to spread wildly. Okay, now here's a quote. Again, this is directly from the CDC epidemiologist, Benjamin Silk. He was one of the authors on this paper, right? He's the second to last author. I'm quoting this, YouTube. He says, before the Delta variant, COVID-19 vaccination status resulted in better protection against a subsequent infection than surviving a previous infection, he said. When looking at the summer and fall of 2021, when Delta became predominant in this country, however, surviving a previous infection now provided greater protection. Okay, so essentially what he's saying there, without saying it, is natural immunity is actually a little bit better for new variants compared to other surrogate sources of immunity. This is him directly saying this. This is not my opinions. Now, what you're seeing here is figure 2. This is a chart, okay? So you can see here, I want you to pay attention to August. Okay, this is when the Delta surge was. For all of you people saying, well, Mike, that paper on October 29th, that was not during the Delta period. The Delta surge was in August, my friends. That first report that the CDC put out on October 30th that said that vaccination was 5 times better than prior infection, they had time to collect this data. You can see here most of the estimated hazard ratios and infections and hospitalizations and so forth associated with the Delta surge were in the early August, right? So my friends, I don't know why this is just now being published in January, right? A full 6 months after the Israeli health ministry. Now, I say this because there's a low level of trust for the CDC right now and for public health experts. That has long-term ramifications. If people don't trust the institutions, how are you going to attract highly educated, highly talented people to go work for those institutions and to publish data like this and to do reporting? You're not going to attract top-tier immunologists and top-tier doctors if the perception of our own health institutions is ignoring the dossier of science that's out there with regards to the protectiveness of a prior infection. And so I think this is worrisome. And I think that you can't help but wonder if politics influenced some of these different decisions and the outcomes of these papers. And that is not good. We should have full trust and faith in our public health institutions that they are operating the standpoint or vantage point of science that is not being influenced by political desires or policies. Okay. And that's why I make these videos. And that's why I also have been paying more attention to politics, because it seems that that is what is going on here, which is really unfortunate. And that should not be going on. So to finish off with what they said here, I just want to share with you some of the data because I think this is actually quite fascinating. Okay. In the pre-Delta period, okay, so this is between June 13 and early June, they said, for example, in this pre-Delta period, compared with hospitalization rates among unvaccinated persons without a previous COVID-19 diagnosis, hospitalization rates were 27.7-fold lower amongst vaccinated persons without a previous COVID-19 diagnosis and 6-fold lower among unvaccinated persons with a previous COVID-19 diagnosis, okay? So that means that there was a difference before Delta came around. Now, here's what's interesting. This pattern shifted, they say, because as the Delta variant became more predominant during, late fall, late summer, early fall, compared with hospitalization rates among unvaccinated persons without a previous COVID-19 diagnosis, hospitalization rates were 19.8-fold lower among vaccinated persons, okay, that didn't have COVID before, and 55.3-fold lower among unvaccinated persons with a prior COVID-19 diagnosis. Now, remember, this is far different from their October report. Let me just share with you again. Hospitalization rates for vaxxed but uninfected prior were 19-fold lower compared to those who were unvaxxed during the Delta surge. And for individuals who have natural immunity compared to those with no natural immunity, hospitalization rates were 55-fold lower. So remember, we heard 5-fold back in October. This is a major difference. So I think it's like, why are we just now hearing about this? That's the thing. After all the nurses, all the first responders, all the healthcare practitioners that have gotten fired, all the supply chain issues, all the staffing issues, labor shortages, the whole thing, all this collateral damage, like this is causing a major mess and a major challenge with regards to inflation. Okay. Like this data has been out, obviously, for quite some time. So, okay, it's good, better late than never. But it's also it makes you scratch your head a little bit, doesn't it? I don't know. Hopefully these images sort of help you navigate through these conversations. Hopefully this data, and you can download the full text PDF. I'll put it in the show notes below. But I think we should be sharing this with our friends and family members who say they follow the science, but disregard someone who has chosen not to get a booster or to get vaccinated because they have already had a previous diagnosis of a disease. Now, when your child gets chickenpox, most parents don't say, oh, you also need to get immunized for chickenpox, right? So it seems that we've sort of lost this logic that was baked into our thinking process and as to how we approach public health has sort of gotten clouded with all of the fear-mongering from the media and this idea that it's a new virus, that somehow because it's a novel virus that humanity hasn't been exposed to, therefore, that humans cannot make any adaptive memory against that, which doesn't really corroborate with historical medical science. If you think about past pandemics, 1918 Spanish flu, the Russian flu of 1890s, how did humanity carry on after these pandemics? Through immunity. So immunity matters, my friends. That's why we need to make health a priority, because the healthier an individual is, the more robust their immunologic memory is after they're exposed to a pathogen. So we got to promote healthy living. We got to promote exercise. The CDC actually did publish earlier this week a finding correlating states like, it was Arkansas, Oklahoma, Alabama, Mississippi. The southern states we know the obesity rates are quite high in those states, but they also showed that sedentary activity is widely prevalent. About 30% of the population does not even get around 2,000 steps a day. So, my friends, if if our health experts were promoting some of these things early on when people were really paying a lot of attention to everything with regards to the virus, we could have made big strides in reducing our rampant obesity and metabolic disease problem. And unfortunately, that hasn't really been talked about. And it was considered a conspiracy theory to even mention exercise with regards to immunologic protection. We know that not to be true. So friends, hopefully you found this helpful. Please share this video and this paper with individuals so that we can spread the message, because we now have I haven't looked at recent statistics, but so many people have been infected, right? So this should mean that the pandemic is, the medical necessity to continue on with all this pandemic safety measures is really not there, knowing the protection that prior infection offers against a future reinfection. So if you enjoyed this content, please hit that like button. Thank you for subscribing. Thank you for sharing this video, and we will catch you on a future podcast down the road. Until then, be well. Bye now.